Great, awesome. So again, welcome. And today's webinar topic is managing sexual health differences after breast cancer. Next slide, please. Wonderful. So I'm very excited to have Dr. Lori Brotto today with us as our presenter. She is a professor in the UBC Department of Obstetrics and Gynecology, where she holds a Canada Research Chair in Women's Sexual Health. She is also the executive director for the Women's Health Research Institute, one of only 3 institutes in Canada devoted to advancing research in women's health. And as a registered psychologist, she provides sex therapy to people of all genders. So we are very excited to have you here today with us, Lori, and I will hand it over to you for our presentation.
Wonderful. Thank you so much for that lovely introduction, and can't wait to hear from our audience. I know you're out there. I can't see any of you, but I can certainly feel you present. So I'm really looking forward to talking about this topic on managing sexual health difficulties after breast cancer. We know that with excellent scientific advances in the treatment of breast cancer, that the 5-year net survival rates are higher than we have ever seen in the past. And that's really the fantastic news, is that the chances of surviving breast cancer, that rate is getting higher and higher with the fantastic advances in science. At the same time, we know that a large number of breast cancer survivors will experience either short-term or even lasting side effects associated with their cancer and their cancer treatment. And the focus of a lot of my work is specifically around sexual health side effects, where we know around 80% of breast cancer survivors following treatment will have difficulties with vaginal pain. It shows up as pain during sexual activity, and also other changes in sexual function, most notably reduction or complete elimination of interest or desire in sex. And given the highly private nature of these experiences, it means that many cancer survivors are suffering in silence. They might not even speak with their cancer care team or their family doctor or even a partner or friends about these issues, which means that they are suffering in silence for quite a prolonged period of time. So why should we care about this topic area? Well, we know that when sexual health and sexual function are impaired, that this can have impacts on many other aspects of the survivor's life. It can reduce their overall quality of life. It can impact their mood and anxiety. It can lead to distress in general. And it can have many impacts on a relationship, friendships, and other domains. So, whereas there may be a societal belief, well, who cares about sexual function? After all, you survived breast cancer. Isn't that the most important thing? And ultimately, that is the most important thing. But at the same time, these kinds of quality of life side effects or outcomes can be very, very distressing to the individual. And so we really want to make sure that that the woman and her partner, if she's in a relationship, are equipped with the best information to help them cope. When it comes to our understanding of the ways in which breast cancer might impact sexual function, we really take this biopsychosocial approach. And what that means is that it's not just the case that breast cancer might impact sexual function because of its surgical effects or because of radiation or because of chemotherapy, but there can also be significant psychological as well as social effects of having a cancer diagnosis. What does this mean to you? How does this impact your sense of yourself, your role in community, your ability to work, your caretaking responsibilities, and also within a relationship for those women who are in a relationship? Changes in the kind of partnership dynamic where maybe for a period of time a partner becomes your primary caregiver and supporter. There can also be, for a lot of survivors, ongoing anxiety about a fear of recurrence. And this is a well-known and well-studied phenomenon that tends to spike after the 5-year period of surveillance, whereby survivors will say that they notice a real increase in anxiety once they're no longer being managed or watched over by their care team. There's sort of a belief that if I'm not being watched anymore, will this increase the chances of breast cancer recurrence? Of course, that's not true. There's no evidence for that, but it's more of a subjective feeling of anxiety. So all of these different things at the same time can directly impact sexual function. Sexual function, of course, being a brain-body experience. It's not just something that is a reflex or dependent on hormones. It really is dependent upon healthy connections between the brain and the body. And that's why with breast cancer diagnosis and treatment, we can see these impacts on sexual health and sexual function. So, a lot of my work has focused on mindfulness, and we know that mindfulness has been taken up quite extensively within the psychosocial oncology field. Many cancer treatment centers across Canada offer mindfulness based programs as a way of managing distress, anxiety, as a really healthy way of coping. And so, what is mindfulness? Again, this might be review for many of you in the audience who have participated in mindfulness based programs. But one way to think about what mindfulness is to understand what mindfulness is not. So, this is a picture of my puppy, and my puppy, like many young puppies, has scattered attention. She goes here, she goes there, she can't focus on one place for any prolonged period of time. And when I watch her do this, my role as her owner is to very gently tug on the leash and bring her back to her place, to the here and now. And I do that when I tug on the leash with compassion and kindness and an optimistic tone, etc. And yet, our minds are very much like that curious puppy. Our minds are pulled into many different directions. We might be thinking about one thing and then get pulled into a thought stream about something else. We can be very highly distractible. And there's lots of evidence that in today's society, with technology and many other ways of accessing our attention in the here and now, that our minds really have a hard time staying present. We also chronically multitask. And then, not to mention, if there has been chemotherapy, a lot of breast cancer survivors will talk about difficulties with attention, concentration, memory recall, and other cognitive changes that can certainly exacerbate some of these difficulties with paying attention. So, mindfulness we define as non judgmental, present centered awareness. That means we're paying attention to every thought, feeling, or sensation just as it is, and we're doing so non judgmentally. That means when the mind takes off or it gets lost in worries or anticipations, we don't beat ourselves up and say, oh, I'm terrible at this paying attention thing. Rather, we just notice where the mind has gone and we guide it back to the present moment, just like we would with that puppy on a leash. In popular media, there has been a lot of attention on mindfulness. We see mindfulness showing up in the workforce and the tech sector. We see an explosion of mindfulness apps to help us develop this skill of paying attention and being present. At its most simple level, if you can imagine eating a raisin, which is often the way that I start mindfulness groups that I lead, it's about bringing all of our senses onto a certain object. So, with a raisin in our hand, we might be noticing its shape, its color, its texture, the weight of it, the smell of it, the sound of it. What happens when we put the raisin in the mouth, noticing salivation? What happens when we take just one bite? And it can be a really powerful way of introducing us to mindfulness and how we can, with intention, we can focus the attention on a particular object. And in fact, what Deepak Chopra said is as you turn unconscious eating into awareness eating, the next stage, awareness living, isn't far behind. And that's really what we're intending to do with mindfulness. We practice these skills in a very circumscribed way with a raisin, with the breath, with paying attention to the body. And then we want to generalize these skills into our life. Okay, so now you might be wondering, what does any of this have to do with sex? Well, in my research lab at UBC in Vancouver, we have developed over the last 20 years mindfulness-based programs for a variety of different sexual health issues. So as you can see on the screen, for many different cancer survivor groups, for women with low desire, for women with a history of sexual abuse, for women with a history of pain. And we've compiled quite a bit of research evidence to show how mindfulness works, for whom mindfulness works, and what are those benefits of mindfulness. And so what I want to do in the remainder of my time with you today is really talk about 3 studies. The first 2 I'll mention briefly, and then the third study on breast cancer survivors with sexual concerns I'll go into in some detail and hopefully save some good time for questions. So the first study I want to share with you is a study that was really focused on women with low desire. So low desire is a very common sexual concern. It probably impacts a third of women across the lifespan. And it's expressed as women saying, I know I'm no longer interested in sexual activity. I have no motivation. I don't initiate. I don't respond to my partner's advances. And it can be very, very distressing to a woman and to her relationship. So after doing some pilot testing, we got some funding from the Canadian Institutes of Health Research to compare an 8-session in-person mindfulness-based program to an 8-session educational program. So in the mindfulness group, what we did was we delivered structured mindfulness exercises. In the session, the facilitator would guide the mindfulness exercises. And then after that, we would move on and cover some educational bits. In the comparison group we call STEP, which was a sex education group, supportive sex education, it was just delivery of educational information. But because we were in a group setting, the various group members would validate one another, support one another. So that in and of itself can be very helpful and therapeutic for women, is just being surrounded by other people who understand what you're going through. Reinforcing the feeling of, I'm not alone and I'm not broken. So these were the 2 groups that we compared. We randomized about 150 women with distressing low desire to one of these 2 groups. We delivered the mindfulness or the STEP intervention, and then we followed them for a year. This is just a snapshot of what were some of the mindfulness practices that we did. So you can see we started with that raisin eating meditation. And then over the course of the 8 weeks, we introduced additional mindfulness exercises, a body scan, which involves mindfully paying attention to the body, mindfulness of breath, some stretch and movement, hatha yoga type exercises, mindfulness of sounds, mindfulness of thoughts, and so on and so on. We also had exercises that taught our group participants to integrate these mindfulness exercises into their sexual activities, either on their own as they were touching their body, or sexual activities with a partner. We also had an exercise where we invited women to pair a mindfulness practice with a sexual tool. And the sexual tool was either a vibrator, encouraging her to elicit a fantasy, or watching or reading some erotica. So we looked at whether mindfulness could amplify the effects of one of these arousal tools. By comparison, in the sex education arm, what we did was just deliver some accurate information. We debunked some myths about sexual desire, but there was no mindfulness in that group at all. Attendance in our group was very high. You can see that over 86% of the women in the 2 arms attended at least 6 of the 8 sessions. For many of them, this was their first and only exposure to sex therapy, and there was a lot of engagement with the homework exercises. Just to show you quickly how well it worked, everything on the left shows the outcomes from the education group, and everything on the right is the outcomes from the mindfulness group. So, focusing first on sexual distress, this is how much bother sexual difficulties can impact the person's quality of life. And you can see that in both groups, they saw a significant reduction in their amount of sexual distress, but this was greater in the mindfulness group. And those benefits were retained a year later. So, this is a year after they finished the mindfulness program, they continued to see reductions in sexual distress. A very similar outcome with respect to sexual desire, with both groups, both the education and the mindfulness group, seeing significant improvements in their sexual desire a year later. They were also more satisfied in their relationships, although this was not a relationship intervention. It was just for the women themselves. And over time, they ruminated a lot less about sexual concerns, which means they worried and were preoccupied quite a bit less over time. So, this study really taught us that an 8 group mindfulness intervention is feasible. Women attend, they do the exercises, and that the benefits were retained a year later. The second study I want to share with you was delivering a similar intervention, but this time focused on sexual pain. And you'll recall that I said at the beginning that among breast cancer survivors, sexual pain and low desire can be very, very prevalent. So these were women who were seeking treatment specifically for complaints of vulvovaginal pain. And you might wonder to yourself, how on earth can tuning into the present moment be helpful for pain? Well, there's a lot of evidence in the general chronic pain literature that mindfulness can actually be very, very effective. It reduces muscle tension, it reduces chronic stress, it helps keep people in the present moment and reduce that tendency to catastrophize, which is worrying about, will the pain ever go away? Will I ever get better? Will a doctor ever find a cure for me? And we also have evidence that mindfulness can actually change the pain centers in the brain. So, armed with this evidence, we thought, let's see what happens when we administer this to women who are seeking treatment for vulvovaginal pain. So again, we got some funding from the Canadian Institutes of Health Research, and we compared 2 different treatment. We compared an 8-week mindfulness intervention to an 8-week cognitive behavioral therapy intervention. And cognitive behavioral therapy, or CBT, is a different psychological treatment that involves identifying and challenging problematic thoughts as a way of improving emotions and improving behavior. And there's a lot of good evidence to show that CBT can be quite effective for managing vulvovaginal pain. So that was the CBT arm, and then we compared it to a mindfulness arm. Um, we recruited about 130 women who were diagnosed by a gynecologist with vulvovaginal pain, and a very similar design to the other study. They had 8 sessions of treatment, and then we followed them over time up to a year later. What did we find? So again, everything in the CBT group is on the left, everything on the mindfulness group is on the right. Pain. So this was a self-report of pain from 0 to 10. And what we found was that if you look on the right-hand side, the women in the mindfulness group had a significant reduction in their self-reports of vulvovaginal pain that was pretty meaningful to them. They started out at 6.5, went down to 3.5, and those benefits were retained a year later. And this drop was greater in the mindfulness group than in the CBT group. So we can conclude from that study that again, 8 sessions of group mindfulness was feasible, it was effective, and those reductions in pain were retained a year later. So, armed with those 2 studies, the finding that mindfulness can improve desire and distress, and that mindfulness can reduce vulvovaginal pain, given that those 2 are very common symptoms in breast cancer survivors, we kind of combined those 2 treatments into a single mindfulness based intervention that was tailored to breast cancer survivors. And this study was just published last week, so it's hot off the press. But basically, what we did was we recruited about 120 breast cancer survivors. Each of them underwent an extensive online assessment. This entire study was done online because it was done during COVID, which prevented people from coming in person face to face. But a really wonderful outcome of that meant that we were able to recruit people, women who were living in quite geographically remote areas that otherwise would not be able to commute into our clinic. So that was a real kind of silver lining of the COVID phenomenon, is that a lot of us turned to online treatments. So women were randomized to one of these two groups, either the mindfulness catered to breast cancer survivors or to the educational group, again, that was catered to breast cancer survivors. And they were followed for 6 months. Here's a tiny snapshot of our participants. You can see the mean age was about 50. Most were in relationships, most were white. The vast majority identified as heterosexual. Cancer was treated about 5 years ago, and you can see the proportion that had received chemotherapy, radiation, and who were on an aromatase inhibitor after their breast cancer treatment stopped. So, what did we find? Again, a lot of engagement. Over 70% attended all of the sessions, and a lot of engagement with the homework. This was a group of women who really wanted to do the homework exercises. We asked them, how much do you think this treatment will work for you? And this was before they started the group. And you can see the ratings there. Pretty good. Most of them felt like that it might work for them. But in the mindfulness group, maybe a bit of skepticism. How on earth can this mindfulness group help with some of the sexual side effects of breast cancer treatment? What did we find? Did it work? So, focusing first on sexual desire, the education group is on the left, the mindfulness group is on the right. And what we found is this was a significant improvement in desire in both groups. In other words, both mindfulness as well as delivering good and accurate educational information improved desire in both groups. Similarly, with sexual distress, both groups saw a reduction in sexual distress that was very meaningful to them. And finally, pain, you can see pretty significant decreases in both groups, mindfulness and education. The women also found that they were ruminating less or worrying less about sex in both treatment groups. They reported being more mindful in general, again, in both groups. And finally, interoceptive awareness, which is that ability to really sense what is happening in the body, improved in both groups. So, what can we conclude from this study? Well, I think the study is good news. It found that an 8 session online group, whether it was mindfulness or sex education, was quite effective for improving desire, reducing distress, and improving pain, with quite large effects on desire and distress and medium effects on pain. And these were all clinically meaningful to the survivors who participated, and that the benefits were retained 6 months later. So, what might we do with these findings? Well, one of the things that we're doing now is we're trying to understand who are those survivors who were most likely to benefit from this treatment, and can we offer this kind of treatment to those individuals once we know who is most likely to benefit? Secondly, it suggests that for breast cancer survivors who are seeking treatment for low desire or distress or pain, that really doctors and treatment centers should be offering these evidence based, low risk treatments, either mindfulness or supportive sex education. And these would be things that we really want to work with treatment centers to make sure that we have healthcare providers who are trained in these areas that can offer treatments. So, in closing, these are a couple of the books that I've written on the topic of mindfulness and sex, my social media handle, and for anyone who might be interested in having access to the actual meditation files that were delivered to the women in these groups, you can get them for free at my website. Thank you, and would be happy to open it up to any questions.